stopped. Somehow it stopped. And I had to spend time with my family members. It was a 3-generation family. And then that I realized that members of my family are very good people. This is a lighter side, a joking side. Because internet is observing people so much that at times they're forgetting what is around. And the irony of all this is, internet was created to save time and it is not taking all the time. With all this, I would like to introduce today's chairpersons. Pawan, please share the slides. Dr. Amrit Patjoshi. No, he has shared the slides of the moderator first, so therefore I am going with that schedule. Dr. Amrit Patjoshi is our moderator today. He is from Bhubaneswar, a neuropsychiatrist, psychotherapist, and wellness consultant. He tells about him. He is the professor and chief consultant of neuropsychiatric in High-Tech Medical College. He is the direct council member of IPS. He is the editor of Odisha Journal of Psychiatry. And he is the chief coordinator of UNICEF, WHO, and the IPS initiative on telemedicine, psychosocial management during COVID-19. Above all these things, you are seeing his face. He is very much smiling, very much affectionate, always eager to work. He is known to everyone. And next one, please. Dr. Alim Siddiqui from Lucknow. He is also a very vibrant member of our Indian Psychiatric Society who is coming up, and our future depends on him. He is the director of Healthy Minds Neuropsychiatry and Behavioral Science Center, Lucknow. He is the visiting professor of psychiatry in ERAS Lucknow Medical College and Hospital, Lucknow, and GSPM Medical College, Kanpur. He is direct council member of Indian Psychiatric Society along with Amrit. He is guest faculty in Amit University, Lucknow, and is the finance secretary of IMA Lucknow branch and finance secretary of APP, IAPP, UP UK chapter. And he is also vibrant, he is always visioned and is always active. Welcome Alim, and he will be showing us, they will be showing the talent in the discussion session, coordinating your questions. Next is our immediate past president, Dr. Bhugesh Vaishnav. He is the director of Samvedana Happiness Hospital and the first private psychiatry setup in Ahmedabad. He is the immediate past president of Indian Psychiatric Society and advisor of the SARC Psychiatry Federation. His area of interest involve sexual medicine, mood disorders, schizophrenia, geriatric and addiction psychiatry. He has a lot of achievements. This slide, one slide is inadequate to contain this. To mention a few, he is the recipient of Gujarati and Hindi Sahitya Academy Awards, Mother Teresa Sadbhavana Award, IMA Medical Achiever Award, LP Shah Oration Award, Awawai Wadia Oration Award of Sexology Conference, MR Kotak Oration Award, BN Mehta Oration Award, IAPP Amritpura Oration Award, and Prasanti Oration Award. So many orations he has given. He is an erudite orator and he has got a very nice grasp for these things. I think he will enlighten us today and he will definitely enlighten us. Welcome, the ever vibrant Dr. Vaishnav. Please, sir. And next, Dr. Mrs. Sasi Rai. He is a consultant psychiatrist and director of Sambal Drug De-Addiction and Psychiatric Center in Lucknow. He is associated with Uday Mansik Swasthya Sansthan, Gomti Nagar, Lucknow. Awards she has received, honored by the Minister of Health and Rural Development, Uttar Pradesh, on Doctor's Day in 2019. Nominated for Women of Substance Award by Hindustan Times. Received the BBC Oration Award of Central Zone. Currently holding the following positions: Chairman, Richmond Fellowship Society, Secretary, Richmond Fellowship Society, India, and Director Council Member of Indian Psychiatric Society, NAB member of IAPP since 2016, is Chairperson of Research Committee of IAPP, is EC member of IAPP, and chairs the Mental Health Review Board of Uttar Pradesh. And positions held in the first, she was the Journal Representative of Central Zone to IPS, former President and Secretary and Editor of Central Zone, former Editor of IAPP, former President and Secretary of IAPP UP Uttarakhand, Chairperson of Election Commission IAPP, Convener Specialty Section on Women's Mental Health IPS. With so much of experience and so much of incumbency, Dr. Shashi Rai is the chairperson. Welcome, madam.
Thank you, sir.
With this, I hand over the meeting to the. With this, I hand over the meeting to our chairpersons, and who will be introducing our speaker, Dr. Manoj, and also our expert with the chairperson of IPS Committee and Cyber Psychology, Dr. Sudhir Bhave. Sudhir and me are very old friends. I always remember. No, this introduction will not be by me, it will be chairpersons. You can keep it off now, Pavan. Our chairpersons will introduce. And Dr. Bhave, I am giving my personal remarks because I feel overwhelmed to see him. And I always remember him in IPS days while conducting the musical programs. I have a small request, Sudhir, if you keep. At the end, when you give remarks, you show a glimpse of your bias, which every IPS member knows. Just a few couplets. With this, I hand over the mic to the chairpersons, Dr. Vaishnav and Dr. Shashi Rai. Shall you please unmute and take over?
Thank you, Dr. Tufan Pati, for an. I welcome my co-chairperson, Dr. Shashi Rai. I welcome the speaker of the today, Manoj Kumar, Dr. Amrit Patta Joshi, Dr. Sudhir Bhave, and I welcome all the delegates of this excellent session on behavior therapy for the internet addiction. As Dr. Tufan Pati has nicely pointed out, that there are a lot of advantages and disadvantages of the internet. Internet for the scientific use came into existence in 1986 in our country, and its public use was permitted on 15th of August 1955. Since then, as per the data available of 2020, hello, I'm audible or not?
Yes, sir, you're audible.
Yes, sir, you are audible.
Yeah.
Very much audible.
Yeah. And as per the data available of 2020, there are 71 crore internet users in our country. So that is 54.3% of our country's population is using, they are using internet. Surprisingly, you must be aware that in the period of lockdown, the internet users increased exorbitantly, particularly from India. And as per the reports from the Pornhub website, latest report of June, during the lockdown period, more than 50% of the traffic was from India, and at least 95% of the internet users serve the pornography from India. So there are positive use and negative use. At the same time, in absence of this internet era, we would not have been able to connect, and we would not have been having so many sessions, webinars, and educational sessions on the internet even during the lockdown. However, there is something like internet addiction. Dr. Sudhir Bhave, as the chairperson of our committee on cyber psychiatry, had come out with the guideline on 14th of June. And he has also come out with a book which will be shortly published on the internet. So today we have an excellent speaker. He will teach us, because behavior therapy of the internet addiction is the need of the hour. you'll be surprised that 8 crore Indian children, that is between the age of 5 to 11, they are using internet, and 20% of them are addicted to the internet. Looking to this data, for each and every clinicians and psychiatrists, it's very important to get training and to be well versed with the treatment, behavioral treatment of the internet addiction. I request the co-chairperson, Dr. Shashi Rai, who is a very knowledgeable person, and I request her to introduce our esteemed speaker of the today's session.
Thank you, sir. Am I audible? Hello, am I audible?
Yes, yes, yes.
You are audible, ma'am.
Yes, madam, you are quite audible.
So first and foremost, I thank Dr. Tufanpati, Dr. Amrit, and Dr. Alim for having given me this honor to chair this session. And internet, as everybody has said, is a very important tool for spreading education, sharing communication, and for entertainment. And in this pandemic area, it has become all the more important. But everything which is a boon, sometimes when used in excess, becomes a bane. And so is the case with internet. And not like India is, after China, India's maximum number of internet users are in our country, more than 250 billion people. And various prevalence studies have shown that more than 0.3 to 25% people are addicted to internet. So we'll hear this from our speakers. The first speaker for the day is Dr. Manoj Kumar Sharma. He is Professor of Clinical Psychology in NIMHANS, Bangalore. He is the coordinator of SHUT Clinic, Service for Healthy Use of Technology. He is member of WHO expert group on addictive behaviors. And his research interest is in behavioral addiction, psychological test development, and he has more than 90 publications. So I welcome Dr. Sharma to start his presentation.
And first, good evening to all of you, and thank you for inviting me for this today's sessions. And I think next 45 to 50 minutes, I would like to cover the technology use and the risk factors and how we can assess it, as well as the interventions which we can carry it out with the people who got excessive or addictive use of technology. So I think this work I started in, I think I can have my slides. I started my work in the area of technology from one second slide. I started my work in area of technology addiction from 2007 onwards, and I think most of my seniors who are here, I think they know that time the cost of internet use and mobile use was very high. Like that time, whenever we used to do any study, we used to ask how much monthly expenditure they had on mobile phone use, which has changed to 2019-20 when we are asking how many GB are they using per day. So much change has happened in last 10 years. So this is a change in information technology, but along with that, our research have found that it is also has a relationship with psychological factors. It brings dysfunctions in family lifestyle. Sometimes I think caregiver burden we do discuss among psychiatric issues, but we found caregiver burden quite significant, especially when children have addiction or children have excessive use of technology, either to social media or to games, which is a quite predominant complaint in our clinic also. So with all, and when we interviewed the user also, some of the users wanted to work on their technology use. So we thought, let's start a service which can provide them empirical information, which can help them out to manage the technology use also. So with this perspective, this clinic was started in 2014. And since other countries have already taken a lead in 2007-8 onwards, like China, Japan, and UK already have the clinic. UK has like recently under NHS has brought clinic for gaming addiction also. So it was appreciated in India as well as abroad also for the India moves to start this clinic for helping people with technology use. So with this perspective, we started this cleaning, and the purpose initially was to build up awareness, to build up manpower, as well as to, through research mode, build up intervention and assessment tool in this area. So I would briefly cover on these aspects. Next.
Just a minute, sir.
So this is one model which we publish. I think if you can see that basically we do talks about Maslow needs and all, but how does the technology has affected this expression of these Maslow needs? So I think nowadays users, and especially excessive and addictive users, do postpone their indulgence in physiological needs, but they feel that in case if they are given a Wi-Fi with good internet connection, with good device, these they can be, or they can postpone even the physiological desire, or the postponement of physiological desires do comes up. So that's a change because of technology use. Second, like earlier, the safety needs used to come through the environment. Nowadays, the safety needs getting addressed through use of mobile phone, and people are more conscious about keeping their mobile phone safely rather than any other things. So that way you see there is a change in expression of safety needs. Then comes the social needs. Earlier, I think the target was to interact with family members, to interact with friends, and to interact with people in the society or in the environment. Nowadays, technology has taken up that role. Now, I think we can interact with anybody through online platforms, which is, I think that's a advantage which we are also using now for, because I'm able to connect with all of you through the technology platforms. So that's a positive side. But somewhere like when technology also started fulfilling the need for affiliation, because like especially if you take example of gamers or the adolescent who are gamers, so now one thing has come, like there is a change in family system has come. Nuclear families, parents are working, single child families. So what happens, the child is left with a lot of free time, and the only available activities are either TV or online platforms. So child also feel that he gets more, his needs for affiliation, his needs for to talk to others easily get fulfilled through online platform. And especially when gamers comes up, people who have addiction to gaming and all, they feel that my parents doesn't understand me. They're always critical of me. They don't appreciate that I have become a third rank holder in my particular game, or I have this level of ranking in my gaming career.
Career.
So they feel that their acknowledgement comes through online friends only. So that's why they are always likes to spend either time with the gaming or with the online friends. So, and same thing happens like social media and all, like people do feel better off while they connect to the social media rather than face to face. And another thing which has come because of technology use, there is some possibility of online disinhibition has also come up. If you see, the all online platforms provide you anonymity for expression. Online platforms also provide you freedom of expression, and people feel less inhibited while expressing their feelings, their ideas on online platform, because they always feel that there is always a denial option or delete option, because sometimes if they send particular message and all and the other person object, they can easily delete and they can say that I have deleted it. So all these qualities also somewhere are also affecting the expression of social needs. Then comes the self-esteem. Self-esteem, earlier it used to be governed by appreciation from environment. Now it is governed by how many likes I have, how many people appreciated my videos, and how many followership I have. And sometimes we also, earlier when the concept comes of modeling, nowadays I think people uh, pick a particular role model who has better followerships and all. So I think sometimes these kind of issues also do create say issues. And then comes the self-actualization. Self-actualization basically means it could be for professional development using technology, sometimes it could be for self-growth, or sometimes it could be on the deviant side of the, because either they become a ethical hackers or particular very excelling in games and other things, they boost up that this is what my talent is. So this is the expression, change in the expression of needs through the use of technology. But when it becomes technology addiction, you can see that leads to lack of involvement in physiological need, which we generally see in our clinic also, which we see in most of the patients who have problematic and addictive use. Second is safety, which is sometimes is a positive thing because mobile is given to the children because parents can know that where are they. But sometimes parents do regret that whether it was the right decision to give the mobile to the child at 6 years or 7 years or 8 years of age, and which led to the manifestation of addictive use. These are all research questions or the issues for debate also. Then comes the social need. If most of your social needs are getting fulfilled through online platform, again it will manifest as a excessive use. Again, self-esteem. If you feel better off your self-esteem, you feel there is improvement in self-esteem because of likes and other things, again it will leads to excessive use, and automatically your sense of self-actualization in virtual world, which become like an immersion phenomena, will also manifest as an addiction. So I think if you look into this, we have to see this model best explain how does the development of technology addiction happens of. Next. So
Yes.
now the need also comes like, so these are some of the, I think I will briefly go see these studies. These are some of the work we have done from NIMANS, and where we found that it has a excessive use of technology also related with certain neuropsychological disturbance, functions disturbance. But we found that neuropsychological functions are better off in users who got mild use of internet. Internet gaming, as I said, always has a found to be associated with psychiatric symptoms like especially depression, anxiety, and stress. And in recently, we published one more paper where we found in terms of prediction, we found anxiety and stress found to be better predictor of excessive use or addictive use of gaming. And it's another study again from young people, from engineering students, which found that we have almost 9.7% to people have moderate and severe use of internet, and it is more in the males, which spend almost 3 hours and more on the internet, and also had a psychological distress. Next. And this is like technology use among adolescents. We found that excessive use happens of Facebook, video games. And nowadays, I think we are seeing even pornography among adolescents is a concern. Child as young as 11 and 12 years have reported experience or watching porn, not regularly, but they had experience of watching porn. And almost 20% of these adolescents also reported distress because of watching this online content, and they don't know what to do with this content, and they feel very hesitant to discuss with anybody because if they discuss, they have a fear that technology will be taken away. So it also implies that there is a need for a high level of communication in the family context. Next. And this is various, not technology, but I think other type of behavioral addictions also are happening in Indian context, like exercise addiction. Nowadays, a lot of people do have a habit of doing exercise regularly and all, but sometimes it do also meets the criteria for addiction. And there is an exercise addiction inventory also, if you want, it's available in the free domain. Then another addiction which we found is work alcoholism, where we found almost 10.5% of the male and 8.9% of the female also meets the criteria for what we call work alcoholism, which used to be a part of somewhere positive addiction earlier, but now it is also a matter of concern because it also are getting associated with other psychosocial dysfunctions. And this is the last is show series. I think this is what we recently published also. It is called binge watching. Binge watching because of various online shows are available on various platforms. And the criteria goes like if you are watching any show for more than 120 minutes or more than three shows in one go, then you can say you are meeting a criteria for binge watching, and which is also a reason for sleep disturbance in most of the people, because they indulge in binge watching during night time and it automatically leads to delay in their sleep also. So be cautious about this binge watching syndrome, and sometimes some of these addiction just require knowledge and just require sensitization to the users. Once they get sensitized, most of the people are able to take action on it. Next. So when do we say that it is a recreational use or it is a addictive use? I think if I go with broadly three criteria, we can define this issue. One is continuous use to desire to access your technology and gaming. I think this question you can ask to all the users which comes to you, like whether they have a continuous desire. If answer is yes and no, if answer is yes, that's the first step toward addictive use. Second is loss of control. Once they start use of technology, do they have a control if they, or they don't have control? If they say they don't have control, and it manifests because especially in PUBG and other things, so we get cases where they play for 6-7 hours at a stretch and they feel that I can still play longer. So it also manifests as, and which leads to avoidance of other predominant activities of day-to-day life. So if that loss of control is manifesting, that calls second yes for addictive use. And the third is continuous use despite knowledge of harm. Though the user know that it is affecting my sleep, because we have seen, so we have seen that people who sleep with the devices, they generally report 60 to 90-minute delay in their sleep. So the advice goes at least 30 to 40 minutes before sleeping time, no mobile phone use so that you can sleep on time. If it is workable, it works wonder for your sleep. Decreased interest in academics, generally seen among young teenagers and young adults. So because, and sometimes nowadays the issue has come because of online classes, because of online thing, they do attend online things, but they also remains busy with chatting also. And one of the studies which we have seen that every time when you get distracted while doing any focus work, your mind takes almost 3 to 5 minutes to reach back to the same concentration level. So it means every time when you are getting distracted for chats, for social media, for any other things, your mind will automatically take so much time to get back to the same concentration. You may get or you may not get. But that's why most of the young adults or teenagers do report that they study for a long duration, but the productivity and the outcome is not significant. So it may be because they are not able to hold concentration for a longer period of time. And there may be other behavioral issues when technology is not available. Nowadays, I think most of the irritability comes when internet speed is slow or internet connectivity is not there. You might have seen in general people also, normal people also, we feel the distress if the connectivity is not there. Or you might see wherever the connectivity is good, most of the people will be there only. So these kind of behavioral change also you can see. So if there is a continuous desire, loss of control, and continuous use despite knowledge of harm, we can say the person is developing excessive or addictive use of gaming or technology. Next. So what are the reasons? First is, I think on an average, we check our mobile phone 60 to 70 times per day. That is a normal I'm saying. And if this normal frequency also we take, and if we're spending almost 2 to 3 minutes every time, so almost we lose around 3 hours to 4 hours per day for recreational or for checking, or it may not be for any productive purpose also. So that much is the normal loss we get every day because of 60 to 70 time check per day. And it can be because of, there is a one phenomena called zero inbox syndrome. Zero inbox syndrome refers to that we have a tendency to make our inbox zero. So every time when so we always have an anticipation that something has come or I have to respond to whatever has come in my inbox, and that leads to high frequency of uses also. So if we have this kind of tendency, sometimes just require conscious control to exercise, to delay the access of mobile phone or to delay the inbox rather than checking it every time. Then comes the accessibility. 24/7 always makes it a preferred choice, because Even night, if you're not getting sleep, earlier the activities used to be like, if you're not getting sleep, read something or take a walk. Nowadays, if people don't get sleep, they start browsing something during night also, and which automatically will further delay their sleep. Acknowledgement, generally the offline world takes time to give you acknowledgement, online world you get immediately. So the delay of gratification somewhere, it doesn't happen, and people find very enjoyable to be on online and get acknowledgement very fast. And affiliation, definitely it fulfill the need for affiliation, which we do not getting fulfilled otherwise in the offline world, and especially COVID time it has become an issue. Then now there is another activity. Earlier we used to say leisure activities, but now leisure activities has gone. Leisure activities has become digital leisure activities. Now whenever we want to relax with our chat, we want to relax with YouTube, we want to relax with show, we want to relax with XYZ online. So it has become like a digital leisure activity rather than leisure activity. Then comes the entertainment, excitement, work from home, and most common is coping. Like sometimes technology is also used as a method to overcome psychological distress. Any change in mood states gets better off if you spend some time with the technology. Sometimes free time, because if you don't have anything you spend with the technology. Boredom, loneliness. Loneliness is a phenomena which earlier used to be adult phenomena, but now young children as young as 10 or 11 years also report loneliness, which is a concern, which also, and they also attribute, because of loneliness I'm using internet. And now lockdown is another commonest reason, and sometimes people feel lockdown will get over soon, so let me enjoy technology, and that leads to sometimes disturbance in their lifestyle. And then comes the social brain hypothesis. Basically means like when we are on the social media and all, people boost up how many contacts I have, how many people responds to me. But when the study was done that whatever the contacts you have, how many contacts gets converted into support whenever you need them. So then the studies finding shows that only first 10 to 50 people only will come forward to help you out when you are in a crisis. After that, people may not bother about you. So this is one study, shows a preliminary trend, but still a lot of work has to be done. But that also challenge, do we have to concerned about so many contacts when they are not getting into support system when you need them? So that's always a conscious decision for every user to take, and to be psychoeducated also. Next. So before we go into the interventions and all, I think there are certain psychological reasons also which promotes technology use. One is sometimes people feel that there is a self-doubt, negative evaluation, low self-esteem, which is commonly seen in people who have excessive use of technology. And sometimes people have this kind of cognition that I am worthless offline, but very important online. I think if I would take an example of one case who got social anxiety and who has an issue that I don't have friends with whom to connect. And he found social media as a platform where he can get connect to everybody, and anxiety doesn't anywhere interfere in his interaction with others, and he started feeling very worthy on online. So that leads to, because that appreciation was there, feeling of worthiness was there, and that contributed to excessive use of social media platform. Or I am a failure in the real world. Technology use provide me the platform where nobody judge me. Everybody is non-judgmental, and I can enjoy the things as I want. So that's also a commonest reason for spending a lot of time on technology use. Along with that, sometimes because sometimes parents are not able to address the child's concern, or the elder members are not able to concerns of other member of the family. The other member of the family feel that nobody cares for me, not the family, not the teacher, or the professional at the work environment. So why not I enjoy myself in the online world, where if I'm active on online, everybody speaks positively, everybody gives positive comments, and I feel appreciated. So that's how these kind of cognitions. So it means somewhere we have to elicit these negative cognitions, which are also working on as a maintaining factor for excessive use of technology or gaming, along with the environmental reasons, which I already discussed. Next. And another thing which comes like blaming and excuse, it is not internet, it is the stress in my life, which is promoting my internet use. And because I need some relaxation, that's why I'm spending my time. And when just spending time, when it becomes excessive, it never remains in conscious control. I need time, internet to deal with the problems in my life. That's another thing, because sometimes people feel better off with the suggestion which they get online world rather than talking to people who are in the offline world, which also promotes excessive use of technology. And sometimes people say it's my sometimes school, college, or parents drives me to the internet, because some of the cases when we see with pornography use, they feel there is some marital issues. He or she doesn't care for me, so that's the only way for me to feel good. And in some of the cases, we also found that they have rationalized this thing for even spending time on dating sites. They feel dating sites, at least I can talk, nobody judge me, and I can enjoy my time. So somewhere the reasons are in the family environment, but that because since they are not addressing those issues, that makes them addicted to one particular platform. It could be dating in the adult people, or it could be other uses of online platforms. Then excuse like it has been a long day, internet helps me to relax. Sometimes people do watch shows, do watch any online program in the night because they feel now I can relax. Whole day I was productive, let me relax. And sometimes when they relax, automatically the sleep is the only domain which will get affected. And sometimes people do reports who have issues with internet that they sleep at 2 a.m., 3 a.m., or sometimes 5 a.m. in the morning. So that way it's also a concern. And it's okay to use internet at night, since I was studying and working during the daytime. Sometimes even young teenagers say that it's okay to play a game at night. Sometimes they play at night because international players are available. Sometimes they rationalize because I am working throughout the day, whatever they're doing, but now I can play because all my friends are available. So these reasons can also promote excessive use of technology. So we have to see environmental as well as cognitive reasons before we plan any intervention for user. Next. So I think these are the commonest psychosocial dysfunctions which are seen in excessive users because of excessive use of screen, mobile phone screen, blinking frequencies comes down, it brings tiredness in the eyes, dryness of eyes, body pain, carpal tunnel syndromes, tennis elbow syndrome. Both carpal and tennis elbow syndrome are the frequent reason for seeking physiotherapy help. And nowadays physiotherapists are also screening people for use of technology because it may be because of excessive use of technology. Psychological reasons are continuous desire to use, irritability, verbal and non-verbal expression of anger. Because
ఫోన్ చేసిన స్టూడెంట్ ఎస్ఎఫ్ఐ
when
అనుకుంటున్నాను ఇప్పుడు న్యూ
Manoj sir, please unmute yourself.
Manoj sir, unmute yourself.
Yes.
So sometime nowadays speed and not availability of mobile phone also becomes a reason for psychological distress. And decreased interaction, that's a dysfunctions we are seeing, that people do have decreased social interactions, lack of leisure activities, and self-care and other things also get affected because of technology. And sometimes people do manifest as deviant use of cyberspace, because I think this case study we have published recently and which we talked in relation to Boris Becker syndrome, which happened in Delhi also. So there we found that maybe because of free time and because of accessibility, these kind of things are happening, but there may be other reasons also. Next slide. So I think these are some of the things which you can screen when you are seeing case with addiction. One is called nomophobia. It is called no mobile fear. And especially when people are not carrying their mobile phone, or when they are restricted not to use the mobile phone, they feel fearfulness, they feel anxiety about mobile phone. And if anybody experience this sort of anxiety for not having the mobile phone, then we call that person has characteristics of nomophobia. Another syndrome is called phantom vibration syndrome, which is called pseudo vibration of your mobile phone. Like all of us sometimes feel that phone is vibrating or some notification has come, but when we see our mobile phone, there would be no notification, there would be nothing, message and all. But this anticipation leads to frequent use of mobile phone, and it happens more among the young adults because they always have a higher anticipation that something would have come, and which leads to high frequency of use of mobile phone. Zero inbox syndrome I've already talked about. Then comes selfie use. Selfie use is a way of representing yourself in the online world. And sometimes, but selfie use is a health concern also, because sometimes people predispose themselves in very risky situations for taking selfie because they want to represent themselves in online platform. But especially in terms of health consequences, American Psychiatric Association has given divided the usage pattern according to the usage pattern. One is like if you're using less than 2 selfie per day, then you are in the normal range. If you are taking 3 to 4 selfie per day, then you have some acute issues of taking acute problem because of selfie use. And if you are taking more than 5 selfie per day, then it's a concern, health concern, which require consultation and which require consciousness on your part to use the for taking selfies. So I think we have to be cautious about using taking selfies. So again, it means you have to correlate this taking selfie habit with the psychological factors. And selfie use sometimes it's also related with your self-esteem also. And sometimes people do want to work on themselves, on their physical appearance, on their looks, and sometimes it also leads to increased demand for cosmetic help also, which manifests as a Snapchat syndrome. So if you feel that there is a need for work on yourself because of online pressure, definitely I think rather than taking cosmetic help, it's better to take a psychological help so that you can work on your underlying issues. Then comes the digital amnesia. This basically goes with that all of us have developed a habit of feeding everything in our smartphone. And so we somewhere that losing that concept of recent to short-term to long-term memory, because we don't have to rehearse anything. And how much it will affect the young generation, we still have to develop empirical evidence. But people have complained that when they lose their mobile phone, it's very difficult to recall even 5 people telephone number, because they have not recalled those number anytime. It has not never become a part of their long-term memory. So it means somewhere we also have to train our adolescent youngster in some sort of cognitive training also, so that their brain functions remain healthy. I'm not saying that technology affects brain function, but it's like a recommended advice to enhance their better cognitive functions. Then comes the doom surfing. Doom surfing is nowadays very common. Everybody is looking for what negative things can happen because of COVID issues. And sometimes people keeps browsing negative information so that they will know everything and they can take certain preventive action, and which leads to spending whole day in browsing this kind of information. So again, this also has a link with your personality. This also has a link with your biases, because when we do anything excessively, it goes with cognitive bias, because we are entertaining certain negative cognitions, and because of negative cognition, these kind of behaviors are manifested. Then comes the digital burnout, which I think may be a part and parcel of all the people who have excessive use of technology. It manifests as a physical distress, it manifests as a psychological distress, and it also leads to social consequences, meaning no interaction with everybody. So if you are suffering from these syndromes, again, you have to work on your technology use. Nowadays, I think recommendation and advice is every 30 to 40 minutes of screen use, take a break. And the break should include blinking your eyes 10 times so the eyes get relaxed, moving head forward, backward 5 times each so the neck get better off, and moving wrist clockwise and anti-clockwise, both the wrist 5 times each. It will help you to overcome the eyes related issues, neck related issues. or carpal or tennis elbow syndrome. So these are the basic advice. Even if it is given to the people, will help work wonder for them. Next. So now the things comes, I think these are the practical things which I brought so that it can be used in any setting. So first is assess yourself for excessive use of gaming and technology. The first thing is, so there are three categories: recreational, problematic, and addictive use. So recreational goes where you feel good, where your productivity is also going up, and it promotes your feeling of well-being, it promotes your social connectivity, it promotes your other day-to-day functioning also. So that's the first thing you are saying. Then comes the problematic use. Problematic use goes with where your habit is becoming habitual. Means you're checking your mobile phone frequently because you are anticipating something has come or I have to respond to something. Or you are, when you are free, you don't want to be without mobile phone. You keep mobile phone with you, which if it is accessible, if it is in proximity to use, it will definitely going to be used excessively. So if that is becoming, that's become habitual use, and that also manifests as an increased time spent on technology use, which also again maybe hours together. But nowadays, I think based on available research, which have talked about technology use in terms of hours of use, which we should recommend. Though I'm not saying this is the ideal recommendation for Indian context, but we have found the mean is around 4 to 6 hours per day. It should not be more than that. And that 4 to 6 hours should also be used for, significant time should be used for productive purpose. So that's another thing. And then because of problematic use, are you developing preoccupation with technology use? Are you developing loss of control, or are you using despite having consequences in your lifestyle? If all these three things are happening, then it means you have moved to the addictive range. So it means you have to categorize people, because sometimes there people are there who are concerned, though they are in the recreational zone, but because of family pressure, because people other around them are not able to understand them, they feel that I am also developing problematic use. Because sometimes children complain that I am spending most of my time either downloading the assignment or completing those assignments. In between, sometimes I check my mobile phone, but my parent always label me as addictive. The child suddenly feels that nobody is understanding me. My parents feel that I am addictive. So it means somewhere it requires careful. You have to listen to the child. You have to listen to the user. What is his perspective is. Sometimes he may be in the recreational domain, and but because of other people feel that he is into they always feel that he or she is always with the mobile phone. That's why they label him addictive. And sometimes people feel that since everybody is labeling me, then why I should not use too much. So that's become like a reactions towards the environmental stress. So it means require careful screening. Next. So this is another commonest screening which you can use in your clinic setup also. It's called 5C, which we have used extensively in our researches also. The first answer will go in yes and no. The first craving means continuous desire to access technology. Answer can be yes and no, but if answer is yes, then it means it's the first step toward problematic and addictive use of technology. Second is control. If control becomes loss of control for you, you don't have control over your technology use. That's become second yes in your lifestyle for addictive use of technology. Third is you are frequently using technology to cope up with psychological issues. If that is happening, that's become third yes in your lifestyle. Fourth is compulsion. Has it become a habit for you? Means you have phantom vibration syndrome, you have zero inbox, or you have repeated checking of your mobile phones and other thing. And last is consequences. Because of all these 4C, you are developing consequences in your lifestyle. There is another term which has come but has not been researched frequently. It's called Facebook depression. Till now we used to ask about reactive depression or biological depression, but nowadays Facebook depression comes when person is not getting likes or person is not getting appreciation the way he or she wants. And since he or she, because of personality, again I'm saying personality, and because of psychological reason, he or she is not able to handle that rejection, which brings change in the mood state, which may manifest as a depression also. So it means that we have to work on, we have to screen whether sometimes the depression could be related with the use of technology or they are not getting appreciated and all. So out of 5C, if you have 4 in your lifestyle or all 5, or client has 4 or all 5, then it basically means the client needs psychological help, client needs psychoeducation, or client needs good screening so that he or she can be educated for promotion of healthy use of technology. Next. So next comes what you can advise. These are the basic suggestion again can be given in the clinic setup. One is take frequent break after 30 minutes of screen use. Do frequent blinking of eyes 10 times, move head forward, backward 5 times each, move wrist clockwise, anti-clockwise 5 times each. 60 minutes of physical activities every day recommended for children between 6 to 17 years of age group, which we see is a significant decline is happening in nowadays because of COVID or otherwise also. And to avoid binge watching, take breaks of 10 to 15 minutes after each episode or a show so that you do not develop a habit of watching successive shows or successive episode, because the guidelines are more than 120 minutes in one go or 3 shows in one go. If you are watching any one of these doing any, then you are suffering from issue called binge watching. Next. And these are simplest suggestions like how a person can assist themselves psychologically by breathing exercise. It could be as simple as slow breath of 5 cycles of inhalation and exhalation, building up leisure activities to overcome boredom and loneliness. And another thing which we generally recommend, I think, which you can also recommend, is called digital fasting. Digital fasting, now fasting is part and parcel of our culture, but now we have to promote digital fasting where whole family can engage themselves in digital fasting for maybe for 30 minutes, 1 hour, or whatever maximum time they can spend, and use that digital fasting time to interact with each other, communicate with each other, understand with each others, so that this digital fasting will promote feeling of well-being in the family. This will promote that everybody is getting understood, everybody is getting acknowledged, and that need for to talk will also get fulfilled through this digital fasting. So I think I would say this can be a best advice to all the clients, all the families, to do a digital fasting, and which will, because once families start doing digital fasting, parents can become a good role model to the child, and the child can also follow those things and can recommend to his peers and others also. Because sometimes what happens, like when any calls comes and when you are in an interaction with the child or a young child or with a teenager, but instead of excusing yourself, you suddenly start paying attention to the phone call, and the other teenager or the family member feel that I am not important, it's the phone call which is important. If that sort of things get internalized, that also develops a preference for technology use. And sometimes most of some couples do recommend, comes with the issue that my husband or my wife give a lot of importance to the calls and all, even though they're talking about something very important and all. So it means sometimes it may be so sensitive also, and depends upon your psychological predispositions and factors. How would you take it up if people are not attending to you? So there is another phenomena called fubbing. Fubbing is like similar to this, like when you are in a group and group is interacting on a certain issue, but instead of you being actively involved in this group interaction, you physically remain in that group, but you always remain busy with your mobile chatting and other things. So if that is happening with you, again, it shows that you have excessive use of technology. So fubbing is another thing where sometimes people do face issues in social situation. Means simple as this, you are not finding yourself connect, you are physically in the social situation, but mentally you are with the mobile phone, and which other people don't appreciate. So if these kind of things are also happening, we have to plan digital fasting, especially when you are in family, when you are in any social interactions. Next. So I think till now in most of our psychological intervention, we talks about sleep hygiene. Nowadays, I think we are bringing the term called digital hygiene. We have to talk about digital hygiene, which includes sleep also. Digital hygiene means frequent breaks while using screen. Physiological needs to be addressed every day rather than postponing, because when we see cases with gaming addiction, before we intervene in the gaming area, first we have to schedule that the child should take at least 3 meals a day, or child should take a bath every day, because sometimes one child takes a bath whenever they have a session with us. So sometimes parents say, why don't you have session every day? At least he will take a bath for the session. So I think so self-care and bath are these things to be uh, assessed, to be advised as a lifestyle change before we plan any significant intervention in the gaming area. Then comes the break after 45 minutes of headphone use. Though it's not empirically, still has to be validated, this figure, but it's a recommendation that every 45 minutes of headphone use, take a break so that they will not lead to any other uh, physical issues. Bring physical activities both outdoor and indoor. Take care of your self hygiene, and which I said in the beginning, at least 30 to 40 minutes before sleep time, no more online activities. I'm not sure how easy it will be, but if you plan, it will help you out to build up control. It will help you out to have your sleep on time, and it will help you out to have a healthy activity on the next day also. This is a concern because as I talked earlier, in 2007 and 8, it used to be 500 recharge per month. But nowadays in 500, you can get X number of GB per day. And sometime if you are busy, if you have not used your quota for a particular day, some of the people feel very anxious before they go to the bed that I am not a good user of internet. I have not used my GB quota today. And sometimes it creates anxiety. So they don't make commitment for healthy use of technology for the next day, but they make a commitment that tomorrow I'm going to use all my GB quota because it's cheaper now. So it means these type of cognitions also leads to excessive use of technology, because one of the case which we have seen, uh, the child was given a mobile phone for half an hour only, because very strict family, and they have taken off TV also, they have taken everything, and they say if we have to control child technology use, we also have to control our technology use. And child was given a mobile phone for only for 40 minutes. So what child used to do in 40 minutes, he used to download everything, and then he used to feed in his system so that he can read or he can enjoy whenever the mobile phone with internet is not available. So it means it's not reduction of technology is a solution. It means somewhere the cyber literacy, somewhere the communication is the solution for healthy use of technology. So digital hygiene. So now we have talked about digital fasting. We have moved from digital fasting to digital hygiene now. Next. And I think these are one app also, which I think you can recommend to all your clients or to anybody. This is called Digital Detox app. It's available free on the Google Play Store. The stages go like you have to register, and you have to, once you register, you will get a login ID for using this app. And then it will lead you to assessment. Based on your assessment, it will also give you your what are the self-help strategy will work for you. It may not be useful for addictive users or excessive user, but people who are in the mild user, people who are in the problematic range, they find it very efficacious. And this app also gives your total daily uses also. So you will get how many hours I have used every day, on what kind of devices I have used. So that will also allow you to plan your next day activities. And this particular link also have all our information material which you can use for your purpose, as well as for circulating to any of one of your clients also. Next. So now comes these are the basic suggestions which can be given to all the clients while working and during your sessions. But I think briefly, I would touch upon this topic, cognitive behavior therapy, which is one of the commonest therapy based on Jung's model we are using. It has 4 components: monitor your thoughts, Identify, help, check what are the thoughts trigger addictive behavior in the user, help the user to develop new coping skills, and generally it's like a 12 weekly sessions. It takes almost 3 to 4 months to complete these sessions. And so next slide. So the 3 phases goes in behavior modification, cognitive restructuring, and relapse prevention. Next. So I think whatever the other suggestion which I have given you are also part of behavioral modification, but I think these are the advice from the model that first advise your client and patient to maintain a daily log of your internet activity. And so that I think he or she also knows that how much change has happened from the time he or she contacted you till they are maintained in the follow-up. But there is always remain a challenge because treatment for technology use is not a self-referred approach. Children are brought by the parents and child is in the treatment because he or she feels that if I would not obey my parents, I would lose certain benefits and all. So they say because my parent has brought me, that's why I'm here. I'm okay to listen whatever you want to say and let me see how much I can do. So it's required like approach to first build up rapport building should be done with the client, where you must just understand what is his technology use is, what are his reasons for technology use is, and if you can do certain assessment also, because certain tools are available which are available in the free domain like internet addiction test by Young. This is a 20-item test which you can use to screen his internet use. There is a internet gaming questionnaire by Pontese. Again, it is a 21-item scale, again available in the free domain. You can use it to quantify gaming addiction. Then there is a Burgeon social media addiction tool, which is used to assess social media addiction. Then there is a tool called pornography addiction screening test, which is used to screen pornography use in adults as well as in children. And there is a binge watching scale also. And there is another scale called motives for online gaming, so that in case if you want to assess what are the child motives to play online games, motives for online game by Josal Demotrovic can be used. So after you do this assessment, it will give you a platform to build up your rapport with the client, rapport with your child. Once you develop a rapport, don't work on technology as a first goal, because this behavioral modification will come later, because he or she may not be motivated to work on any behavioral modification in the first few sessions. So first build up the rapport through interview, through assessment, and talk more what are his reasons, what are his plan and other things. And collaboratively plan a lifestyle changes. Plan a like how he or she can structure his day-to-day activities. Means plan his sleep schedule, plan digital hygiene, plan digital fasting, which he or she may be willing to work on it, because you are not cutting down his mobile phone, you are not cutting down his or her technology use. Once he or she started following your advice for lifestyle changes, then the stage come for behavioral modification, which may takes, maybe you may achieve this stage somewhere around second or third month of your contact with the child. So that much time generally child takes to bring any modification in their lifestyle changes. And once he is following that lifestyle changes, then you can work on this suggestions for behavioral modification, which could be there. You can advise him to build up a daily log of internet use and establish the baseline for treatment, that where you can see how much he can control and what are the other activities are contingent for using technology use. Pinpoint, elicit what are the situations, triggers, events that contribute to online activities. For example, when a client spends time gaming to avoid stress or experience at home or school, so these can be the situations. You have to plan a solution for them and help them to understand the impact of online activities. So these many things we have to do maybe second month or third month when the child is quite cooperative. And this child may not be very regular in your follow-up also. So from the clinic, we make a judiciously, if the child has not followed up with us for 2 weeks, we make a call or we send a reminder to the child that we have not seen you. I have not interacted with you. How are you doing? When we can meet again, when we can interact again. So somewhere what you are offering the child that you are here to provide him help in case if he looks for. So if this kind of context remains, child automatically sometimes start talking to you and may be willing to work on his or her issues also. But sometime before behavior modification also comes, we have to work with the family also, because in one particular example, we have found the girl child has come from a very culture, religious family. And once the family found her that she was accessing some pornography content and she was reading some adult material. So the family become very conscious and they become very disturbed that this is not our religious training. And how can our girl child can do this thing? And if she continue this way, what will be her future? What will be her marital life? So, and that way, and they say that she may develop a addiction to pornography and other things. So when these kind of, and they made, and otherwise the girl was very brilliant and was preparing for medical and all, but these concern from the family made the child a very lonely child in the family. So when we sat with the child, we realized that child was very introvert, child was very submissive, child got, because if you say the children start sharing pornography content, or they start sharing pornography stuff as young as 11, 12 and 13 years of age also. And they generally have peer talk, or they, and sometimes this girl also came to know a lot of pornography content and all. And since school doesn't allow this kind of discussion, because though there are rules, but I think most of the school doesn't discuss sex education. Family is also very much perturbed to discuss this kind of issue. So she felt that maybe pornography, maybe adult material is the right way to address her concerns. So when we came out with this feedback, the parents initially find it very difficult to assimilate that information, that whether this could be the reason. But the father was very receptive. So we used that father as a co-therapist, and we brought father into the picture, and we brought how father can reduce her anxiety and how father can build up an environment where this girl child can interact with her in a more relaxed manner, so that her concerns can be relaxed. Same way we have found that adult male who was working in an IT company, living alone. Once he reach home, he doesn't have anything enjoyable in the home setting. He got found that dating and all is a platform where he can enjoy. So initially he started enjoying free dating sites. It used to be whosoever is available, talk to them and move to the other things. And slowly, once he started enjoying these available free sites, he also developed a habit of collaborating or having a more consensual sex relationship with whomsoever he met. And then it became a habit for him that every day he used to spend on dating sites to look for a contact who wants to have a physical intimacy, and move forward. And that way he developed a addiction for sex also, as well as excessive use of dating also. So these are some of the concepts. So we have to modify our behavioral modification screening depending upon the type of cases we are seeing and the way we have to evaluate them. Next slide. And I think these are specific techniques which we use. Relaxation training sometimes we do because there are psychological reasons which are working as a maintaining factors for use of technology. So it means we have to work on their anxiety. It could be through mindfulness. Sometimes it's assertiveness also through role play, that how they can say no to various demands. Sometimes it could be peer demand also, because when I would say role play for assertiveness, most of the children say that my friends talks or my school friend talks when they're playing online games. So in case I have to talk to my friends, I have to be on online games also. So it means he or she also has to learn skills to say no and find an opportunity where he or she can interact in a different way with these friends, and coping with urge, how they can cope up with the urge, like maybe through distractions, maybe through engagement, or maybe through digital fasting, or maybe through digital hygiene, or building up a small control whenever they are accessing technology. Next. So I think that this is the basic paradigm which we use for cognitive restructuring if you are planning CBT work. Identify these maladaptive thoughts along with the behavioral suggestion which I have given you. And I think the whole intervention program generally sometimes takes, I think myself, I know that I may not be doing justice to all of you, but I think sometimes it takes 2-3 sessions to tell you everything in detail and how the process goes, but I'm touching upon all these things. So cognitive restructuring goes with identification of ABC analysis, maybe in terms of antecedent, belief and consequences. Antecedent could be like any antecedent situations which trigger stress. Belief could be that I am nobody, I can never study well, nobody loves me, I might spend my time with the online world. So these can remain a justification at cognition level, and consequences would be excessive use of internet or feeling anxious or offline. So even if you plan this type of simple cognitive restructuring, you will get a lot of hints where you have to work more at behavioral level, more at cognitive level, or more at family level, because sometimes it may not be individual work. We have to bring family also into the treatment so that child can be helped in a better way. Next. So these are various relapse prevention strategies. Understand what are the triggers on online binge, reduce harms associated with the online use. Sometimes this is like also a triggering factor, because in one case, like we talks about abstinence violation effects, which is quite common in substance use. And we also found that abstinence violation effects do happen in when, especially this case we documented with pornography use. The person came to us, he did very good with the treatment using CBT approach, and he maintained good control over his pornography use for 3 months. And after 3 months, because of XYZ reason, he again felt a desire to watch the pornography thing. And that one incident led him to that cognitive feeling, the guilt feeling that I can't control my use of pornography, and which again lead to recurrent use of pornography also. So it's mean there is a similarity between substance use and online addiction also. In this reference, I also want to bring to your attention, in one case report, we found this one particular case came with the use of, earlier, he had a history of cannabis use. And subsequently, he developed along with cannabis use, he developed a preference for watching porn. And while developing this preference for watching porn, he developed an excessive use of watching porn, and he started spending 3 to 4 hours in watching porn only. So during screening and during clinical interview, we found that once his use of pornography has increased, his cannabis use has come down and cannabis use becomes 0. So somewhere, because we don't have many case evidence, but this is the only one case we documented. So we found that hypothetically, maybe the brain reward systems remains the same. The earlier the reward he was getting through cannabis, he started getting the same reward through pornography use. So we propose hypothesis whether online activities can become a replacement for other addictive behaviors also. So, but I think this is one case-based report evidence, require more screen empirical validation, but again, it's a research issues. So these kind of cases also, as we do in a substance use, we have to motivate them for relapse prevention, prepare them for various triggers, and help them out how they can work on it, as well as on abstinence violation effects also. Next. So these can be the change plan worksheet, which you can start filling up from the very beginning, so that you will know how much change has come from pre to post intervention level. Next. So I think these are two cases I thought I would bring to your attention. One is called, I think this is the term which we coined, I think we publish also, called comfort internet browsing, because internet browsing itself has become a comfort, like you feel better off. So this case has come with, he's an 18-year-old boy who's used to spend 7 to 8 hours in a day, because whenever he feel upset or whenever he has any kind of psychological distress, and because of that he developed dryness of eyes, he developed texting neck. And when we interviewed this child, we found that there is a clear association that there is nobody to talk in the family, there is less communication in the family, and he doesn't have any other leisure activities. So sometimes the internet addiction may not require CBT work, sometimes it just require basic psychoeducational work, basic motivational enhancement work with the family, with the user, which can bring wonderful change. And this is the same thing which we did with this family. We educate the family, we bring a lot of reinforcement in the family, and we also brought certain daily structuring in the child, this 18-year-old boy, and which brought wonder for this child, and he started showing reduction in his technology use. And same way, it's not video game, but I think it's sometimes video games also brings lifestyle changes. You can see lifestyle changes can come in child's academics, not taking meals, aggression towards parent, which is a commonest problem nowadays. Parents do ask whether because of this PUBG games, my child has become violent, but sometimes these findings still has to come that whether playing these violent games itself can trigger of aggression, because sometimes it could be a state phenomena, because when they are playing this kind of aggression games or riots games, they may be in that particular game and they might have immersed in that game. But when anybody disturbs them while playing these games, they become very aggressive. Or sometimes because of their certain personality predispositions, games provide them an opportunity for expression of those personality predisposition. That's why they feel better off while being on online game. So it means sometimes blaming everything on game may not be rational. We have to see an interaction between games and the personality and other psychological factors also before we plan any intervention. So next. So I think these some of the messages goes for parents also, like sometimes parents feel that taking technology is the solution, that when the child is addictive, take away routers, take away technology, take away Wi-Fi, he or she will become normal, which may not happen, because child has developed certain use of technology in their daily lifestyle. If you take away technology, they may become resistance. In one of the case, we found that child was around 12 years, single child, has excessive gaming habits. What the parents have done, they have taken away his PC system, they have taken away internet, and he was left with only telephone, with the television. So what that, and he stopped going, and he was not going to the school. So what child did, he was spending his whole day in watching television program only. He said that if you will not give me my PC, if you will not give my games, I would not go to the school, I would not go to do anything. I would just watch TV program. And he used to watch anything which used to come on, and he did not used to pay attention to self-care. He did not used to pay attention to food and other things. So it means it's require a lot of work for the family also before we plan any change. Then parents have to be educated for spending quality time with the children. Parents have to do enhance their literacy about cyber issues, because most of the families do, because one of the family has come with the concern that my child as young as 9 years typed a word porn on the Google, which the child later denied that it was just a curiosity because my friends or somebody interacted. So, but the family became very much cautious that maybe the child has developed some preference or may become an issue for. So it means parents have to have literate themselves in cyber related issues so that they can educate the child also. Do not, and the parents' advice is, do not indulge fear, do not indulge guilt, do not indulge shame in the child. Take small steps, talk more, give them confidence, show your care to the child. He or she may open up to you and may reduce his technology use also. But if nothing works, then you are the you can always advise them to consult professionals also. Next. So these are various guidelines which WHO has also given. I think this American academies have put up, like less than 18 months, no screen use. I think this is a mistake, except video chatting is also not allowed. It's recommended because we don't know how much would be the effects of screen use for child as young as of 18 months. For children 18 to 24 months, again, very limited time of screen use. That should be high quality time along with the parents. And children 2 to 5 years, again 1 hour, not more than 1 hour of quality program times. And for children less than above 6 years, again establish a consistent limit, but focus on physical activities, focus on offline activities, bring digital fasting, and promote digital hygiene in yourself as well as in the children's also. Next. So I think the takeaway is always be aware of signs of digital addiction, spend valuable time with the family, friends, hobbies to be cultivated, alternative pleasurable activities, and always motivate them to seek help so that they can be helped in a better way. Next. So I think we have to build up a model also. Still, I think we are also working on developing intervention program. We have already evolved through ICMR help, but we have to see large number and validation also to see the impact of this intervention. But I think I will be willing to share if you want to use it for your research purpose. And we have also evolved scale for internet use, mobile phone use, and pornography thing also. If you want, we can share with you. And we also found preliminary evidence that mild use of internet or gaming facilitate cognitive functions. But this is a preliminary finding. Still, we have to go a long way to develop a actual figure for this. So I think always question remains, do we have to plan internet fasting? Remains answer to or to advice to be given to the families or to the user along with the CBT work as well as the behavioral work. But still I think this is a learning thing. We are also learning. I think whatever we are not, we have slightly better experience, but we are not also the expert, I would say. But we learn through clients, we learn through families, and we help them out in the best way. Thank you.
Thank you, sir. An excellent deliberation. Shashira ma'am, can you introduce Bhave, sir? We have a short presentation from Dr. Sudhir Bhave. Pawan, can you put up the details of Dr. Bhave? Shashira ma'am, you kindly introduce, sir. Dr. Shashira ma'am, can you hear me?
I think Alim.
Murugesh sir is there?
Yes, sir, I am here. Sir, it was just a comment. Dr. Manoj Kumar, it was an excellent presentation. I should congratulate you the first. I have received numbers of chats, numbers of comments on this platform. Over and above that, I am sorry that I was doing multitasking and there are 11 messages which has come to my personal WhatsApp and message group that please request Manoj Kumar, Dr. Tufan Pati, Alim Siddiqui, and Amrit, those who are successful in arranging such an excellent talk. So please see that they provide the recording, the write-up, and the slides. Sir, it is your prerogative, but this is the request I have received. There are many questions. Will not go into the detail of the question. That depends upon the timings which is available. But there are many questions even I would like to ask you. Yes. And there are many questions people have asked. But before that, I'll introduce Dr. Sudhir Bhave. Thank you, Dr. Manoj Kumar, for excellent presentation. And once again, I thank Dr. Tufan Pati that before IPS brings Dr. Manoj Kumar, the Odisha State Psychiatric Association, you and Amrit Pattajoshi and Alim Siddiqui, the great trio, has done a great job. So over and above Manoj Kumar, thank you all the three people, those who have done the top job. Now we have none other than Sudhir Bhave, who was instrumental in forming the guideline that is on internet addiction and internet use. Dr. Sudhir Bhave is the Professor, Department of Psychiatry, NKP Salve Institute of Medical Science, Nagpur. Though he is not addicted to the internet, but he's a very good singer and probably he's addicted to the music. His current position is chairman of the IPS specialty section on cyber psychology since 2018. His achievements are authored the IPS recommendations for the screen use. A 10-page book was released by me on 14th of June, and soon he is coming out with a book which will be published by JP Brothers, probably in a couple of months. So recommendations are already released. He's editing the first book, that is Cyber Psychiatry. It's an IPS publication. So with this, Dr. Sudhir Bhave, your comments and now your part to share to our august audience.
Right. Thank you very much, sir. Am I audible?
Yes, sir.
Yes, sir.
Yes, sir.
Thanks, Dr.
Yes.
for this very succinct introduction. Those of you who are worrying about my presentation, let me clarify. It's not a presentation. I was suggested that I express some of my thoughts on this topic. I would be rather brief and maybe look at things from a psychiatrist's point of view. I must say that Dr. Mohan Sharma has covered the topic so well, so comprehensively, that I have hardly anything left to be said. But then, with this responsibility, I would just share some random thoughts. First of all, I would think that internet addiction is quite difficult to treat. I think it's a common knowledge amongst us that treating any addiction is not at all easy. The figures for any addiction long term are quite dismal. Like alcohol addiction and say 6-month remission rate, 1-year remission rate, 2-year remission rate, they are all quite pessimistic. And I would not be surprised that if the follow-up studies of internet addiction reveal something similar. So something which is not at all easy to treat, and I think we better equip ourselves with the inputs of the kind that Dr. Sharma has given. Now, as a clinician, in fact, I'm addressing all the clinicians here. Like when we see a client, whether a child or an adult, and examine him for any kind of internet addiction, I think the gold standard today is a fairly detailed history and a fairly detailed examination. Because unless we know all the facets of addiction, it's very difficult to do. Management of addiction has got to be multimodal. There's no doubt about it. Dr. Mohan Sharma did allude to the different facets that we need to elicit, like the background factors, the trigger factors, and so on. Now, let me tell you that there are two schools of thought here. One school of thought says that internet addiction, or something that is called as pathological internet use, is only symptomatic of a deeper background pathology. And the second school says that internet addiction is a different psychiatric entity in itself. Now, I, for one, believe in the first school, because I believe that you take any kind of internet-related problem, and there has got to be some background to it. It could be a temperamental variable, it could be a personality trait that predisposes to pornography addiction, shopping addiction, stock trading addiction, or whatever you want. So I think, first of all, the evaluation has got to be detailed. I think one thing that we as psychiatrists should remember, that internet addiction comes with a lot of comorbidity. I'll just go to one study by Carley some years back. Carley, he studied 20 detailed epidemiological reviews of internet addiction, and he found very high percentage of comorbidities as psychiatrists should interest us. For example, just to quote him, about 76% of internet addicts had depression, about 50% had anxiety disorders, 100% had ADHD, 100% of all the responders. A significant proportion had substance use, alcohol use as comorbid problems. So I think when we evaluate, when I say that the history and the examination has got to be detailed clinically, one of the reasons for that is trying to find out the comorbidities. And let me express here that the treatment has got to be a multimodal treatment. Nothing short of a multimodal treatment in any case will do. And when I say multimodal, it basically boils down to three things. It's giving it simplistic structure. One is individual counseling or psychotherapy. Second is family therapy, because without the spouse or the family, parent, it could be quite difficult. And third is pharmacotherapy. Now, about individual therapy and family therapy, Dr. Mohan Sharma has talked adequately. I won't express anything there. But something regarding pharmacotherapy. Now, when I say that 76% have depression, I mean, in that particular study, 50% have anxiety, 100% have ADHD. I think therein comes the role of pharmacotherapy. And in internet addiction, if you look at all the data that we have available till date, I think some drugs that have been found to be fairly useful are one, SSRIs. SSRIs not only because of the comorbid depression and anxiety, but it has been shown that even in non-comorbid internet addiction, the number of hours of internet use does come down significantly with SSRI. I think that is one treatment that's important. Second important finding is use of naltrexone or opiate antagonist. By more than one ways, naltrexone is known to reduce the pleasure associated with internet addiction. And in fact, these days, naltrexone is being touted as perhaps the drug of choice for behavioral addictions. In fact, I have used naltrexone myself in quite a few cases with internet addiction, and the results have been fairly encouraging. Now, ADHD being very common, I think it makes sense that we use some anti-ADHD medication like atomoxetine or methylphenidate or something like that. So I think this kind of multimodal treatment is extremely important. One thing that I think is very important here is, in fact, Dr. Mohan Sharma alluded to it, the use of apps. You go to Play Store and you will find a large number of apps which are there to help you control your addiction. Dr. Sharma did mention an app developed by his Shut Clinic. And I'll just give you a small example very briefly. One app called App Detox. There are multiple apps, App Detox, mobiles, and there are too many of them. So I downloaded App Detox और उसमें हम लोग setting कर सकते हैं. तो मैंने ऐसी setting की कि I should not be using WhatsApp for more than 1 hour per day. Now, for the past many months, I have made a schedule that morning में आधा घंटा, शाम को आधा घंटा. I try not to use it more than that. But the first day I downloaded App Detox, I found that 1 hour was gone quite easily. Though I, for one, hardly use WhatsApp for entertainment purpose. So that tells me that our use is not as little as we would like to believe. And I think just out of interest, you could download one such app that monitors the time that you spend on internet and just see for yourself. I have a very strong feeling that most of us will find that we kind of underestimate the kind of time we are giving on putting on the internet. One important thing that comes to my mind is that these days, a wise parenting has become extremely important. Now, wise parenting is something which we know by common sense, intuitively. It has been important for ever since human beings came into being. But in these days of digital media use, I think it's all the more important. A parent brings a child who is 14 years old with complaint कि डॉक्टर साहब मोबाइल बहुत ज़्यादा यूज करता है, हमारी बिल्कुल सुनता नहीं है, हमसे झगड़ा करता है. Now, this reminds me of conduct disorders earlier. If a parent came with a child with conduct disorder, we know it's not easy to treat because it's extremely difficult for the parents to take a 180-degree turn and kind of change their parenting styles. So the same thing applies here. So I think it becomes all the more important that parents use their wisdom in bringing up the child from a very early childhood. The kind of positive communication, the kind of mutual regard, respecting the child's wishes, and anything that comes under the rubric of wise parenting. I think that needs to be done from the earlier days so that later when the child enters puberty or adolescence, you have a say in his or her internet use. You are able to implement discipline. You are reasonably firm but not harsh with the child. So I think these are the days when we need to educate the parents a lot about what all can be done with regard to child upbringing. I'm reminded of the words of Mary Icon. I don't know how many of you have heard of Mary Icon. Mary Icon is a psychologist from UK who is an authority on cyber psychology. If you can catch hold of a book by the name Cyber Effect, it's a wonderful book. Go on the Amazon and get Cyber Effect, and it gives you the entire rubric of psychological difficulties associated with the internet. And one sentence by Mary Icon really struck me. She said that the internet is going to alter the course of human evolution, looking at the frequency and the pathological way in which youngsters have been using it. Now, these words are very, very, very alarming. But I'm sure that they are not far from the truth. That internet could change the course of human evolution. The way children's brains are developing, the way they are getting hardwired, the way we are depending on technology for our memory, like Dr. Mohan Sharma said. So I think these are the days when we need to be rather cautious. I would again completely agree with him that let's not make a monster out of technology. Technology is definitely not bad. I think it's the wisdom that parents use, the wisdom that the adults use, the kind of communication that the parents have with the child, I think which are kind of the biggest arms that we can have in our armamentarium. So with these brief comments, I would like to stop here, and I would be extremely thankful to Dr. Amrit Pathadoshi, Dr. Tufan Pati, and all the organizers here and the chairpersons. Thank you.
Thank you so much, sir. Sir, Dr. Bhave has covered few of the questions that came out in our chat box. So I have a friend of mine who is also one of the moderators here. He has a habit of going into web series, Netflix and Hotstar. So I think that is one of the important areas which needs to be addressed now. The series that are made now, you cannot just get out after watching one episode. One leads to another, another leads to another. So Dr. Manoj, what is your take on this series addiction?
Series addiction is a concern, and as you rightly said, it's very difficult to move out in between or after one show. I can understand, though we have discussed one criteria, but it's very difficult to implement that criteria. But I think it's always remain a conscious decision. I think it should not become a repetitive activity, because once in a while we can't stop, but it should not become repetitive activity. It should not lead to loss of control frequently, that you don't have control over your binge watching series and all. If that is managed or checked, I think they can enjoy.
Sir, is there any studies regarding personality or temperament and internet addiction or cyber addiction or screen addiction, sir?
A lot of work has been done by more on psychiatric morbidities like depression, anxiety, and stress. But I think the available studies are there also on the using Neo5 and internet addiction and gaming addiction. And especially in personality, people have coined like maybe neuroticism goes more with the internet addiction and gaming addiction, vice versa, in comparison to other factors of personality.
Alim.
Thank you, Bhave sir. Thank you, Manoj sir, for saving me. Amrit was trying to trap me, but he couldn't. So, sir, I'd like to share two children we had. We saw. One was, I think, 1 year back, and one is my relative's home. What they told that they handed over the mobile to the child, and gradually there was loss of eye contact. Speech was regressed. He lost the words that he was from words. Sentences he shifted to words. So, have you seen such cases? What is your experience that small children, toddlers, and 5-6 years old, they are losing their milestones, and they recovered when the mobile was taken away, and they were asked to interact with people?
जैसे इस तरह का I don't have much experience, but only one family came to me. This is like a one event only. After attending my talk, one parent thought like we would also bring control in our child. So the girl child was 3-year-old. So what they did after attending my lecture, they took away the mobile phone from the child. So the child became very arrogant, child became very disturbed, and she stopped taking food, she stopped cooperating for any self-care. And even those changes in the child didn't bring mobile phone to her, then she threatened that I would leave the house. So parents become very much concerned that how can a child young as 3-year-old can threaten for mobile use to leave the house also. But though that was like a child talk only, but parents become very much disturbed. So it means like, but I'm not sure about milestone, but that area has to be seen. But early introduction of mobile phone may definitely develop preference. And as we said, Dr. Sudhir Bhave also said, like if there is not much family communication, not much family interactions, not much family bonding is happening, because which we have seen more increased technology use bring down your social bonding. And there is a term called social capital. Earlier we used to talk about money capital, but now we talk about social capital also. Because of technology use, our social capital has gone down. We have very few contacts in and around us, but we have a large online capital. That's a change. But especially in relation to children, to your question, I think I don't have much experience, but it has to be seen.
Can I respond to this?
Yes.
Yes, Bhave sir.
Yeah,
Yes.
there have been some studies in small children. Of course, means it's not my personal experience, but the studies are in the sphere of child development. We say we use of the screens, and they've seen that there are 3-4 areas in which that child's development is delayed, though not exactly regressed, but development delayed. And some of these areas are, one is social development, because of poor communication with parents, with significant adults. So the social milestones are delayed. Secondly, cognitive functions like memory, visuospatial function. So the kind of things that can happen only in a real 3D environment. So they kind of take a backseat when you look at a 2D screen. So these are some areas that have been shown to be deficient. In fact, children with excessive internet use have been seen to develop autism-like features. Not exactly autism, but autism-like features. So poor eye contact and poor ability to communicate, poor linguistic development. Language development has been shown to be delayed in children showing excessive cell phone use. Yeah, so there are problems there.
Amrit.
Sure. So this answered, few of the people have shared these things, that they had children at 4 years of age who stopped communicating and they were assessed for autism. So thank you so much, sir, assessing, handling this question, sir. Now, how to, suppose a child comes to us, we have a lot of children who come to us, sir. If their mobiles are taken away, they become very aggressive. I had a very senior police officer's son who committed suicide. He was maybe in standard 7 because he was not given his mobile phone. So where do we cut the line? Yes. Where do we think that this threat of ending my life? I have a lot of kids who come to me, parents who come to me. They threaten that if my mobile is taken away, if I'm not allowed internet packages, this many GB, I'll end my life. And once in a while, we end up losing somebody. So how do we deal with these cases where the behavioral issues are very, very severe? It's not just a 3-year kid. The people are trying to kill themselves. People are trying to end their lives. People have become very, very disruptive. So where do we catch the bluff? We know a lot of children are just bluffing that yes, if you don't give this, we are going to cut our hands. So there is a deliberate self-harm in terms of manipulative behavior, and there are serious threats. Sir, how do we manage these children? Or maybe the adolescents.
And I think in relation to this question, because one is technology use in the children, which is a concern. But now what we are also working with, we are working with gynecologists, we are working with pediatricians also. So the gynecologist is the first few, so I think so that through gynecologists we can educate the new mothers, and also that cyber literacy can go in those things. Through pediatrician again, because they have a maximum contact before the child comes to us. So they should also be trained. So we are working with Indian Association of Pediatrician also, so that all pediatricians can be trained in screening and educating for technology use. So these two definitely is the step which we require. But once the child comes, then I think it's require more family work. It's not before we blame the child. It's, I think the family has to work from the young age. How much control they want, how much technology use they have, and they have to build up a daily schedule so that child also pick up, this is going to be my time for use of technology, and this is going to be my time with the family, this is going to be my time with the, so these kind of family activities has to come up from the very early age. Because when child comes to us, he or she is in 14 years, 15 year or 10 year, already child has developed certain behavioral pattern, which may be because of technology use and which may be because of certain psychological issues. Like it was said, like generally we screen for autism and other issues also. So it could be a coping method for those also. So then it's required different kind of management altogether. So it's mean it's going to be multi-steps interventions at different level if we have to bring this problem in a more healthy manner, and it's required more public approach. I think more public awareness program has to come, and all stakeholder has to be involved. I think it's not going to be our, though it's a comes under mental health issue, but all stakeholder in the child development has to be brought into the management scheme so that we can succeed.
Dr. Gautam
Amrit,
Shah has a question.
Amrit,
Dr. Gautam Shah
yeah.
has a question. Please.
Amrit, what I want to know that there are lots of kids are coming along with their parents. Parents are complaining of they are using net, especially at night. At the midnight, they call conference calling with their friends and they see series, whatever, but especially at night, which causes insufficient sleep and daytime sleeping, lack of attention, concentration. What is your take regarding this?
I think because as we discussed and Dr. Bhave also mentioned, because technology use, we can't say technology, I would say it's like an iceberg. But I think we have to see what are the other majority of the problem which is promoting technology use, which may be family issues, maybe other issues, or maybe he or she is not getting any moments of relaxation, which he or she is getting through this online activity. And sometimes child also feel that this is the way for me to enjoy the thing. So there would be multiple reasons for each child which may be maintaining these uses pattern. And but each child, we can't say with judgmental attitude that you should stop use of technology at night. We have to understand sometimes there might be a good reason that that is the time when I do other activities. And also in case if parents feel that that is advisable, that is okay, then they can leave the child. But if they feel there is reaching that certain boundaries and all, then I think definitely the child has to be helped with other factors and all.
Manoj sir, there is a question.
Thank you.
Thank you, sir. Manoj sir, there is a question that most of the time, the teenagers who come, they do not have motivation to reduce internet use or gaming. They say कि मैं नहीं घटाऊंगा. So how do we address this motivation issue?
नहीं, यहाँ पे मैं कहूँगा कि we have to bring a balance. We have to encourage other offline activities engagement. So because if we target technology use, child will become resistant. But if we target other offline activities engagement, let's say that he or she can play with their parents, he or she can go out, she encourage those activities without bringing any reduction in the technology use as a first goal. So the child become cooperative. And once he increase those movements of control in his day-to-day activities, then we can say that you are doing so good. At least you are doing, because sometimes child feel that I have not never spent time in my drawing, I have never spent time in my hobbies. So let's build up those hobbies, let's build up those moments of relaxation, leisure activities in child. That will bring a reduction and will bring a balance. But it's going to be long active activities and there are going to be a lot of ups and downs. But as a therapist, we have to keep motivating families, we have to keep motivating child, that they have to work on balance, and so that it will be bring more positive interaction in the family context.
Sir, we have some questions coming that where the child comes, the parents bring a child with, internet addiction or cyber addiction, and on careful examination, the child tells, or maybe on questioning or interviewing, the child comes out that my parents are always on the internet. So many times I have seen such cases, and I always tell the parents, you sacrifice your smartphone. And I've seen some very good results when nobody in the family uses the smartphone if it is not absolutely essential. If the the working man needs, I tell, use it in the office or keep it in your car. When you come home, please don't use your smartphone. I don't know whether this technique is right or not, but I have had some good results. So what is your take on when we have families like this that come with everybody into this and only the child being
Definitely, because child always have a complaint that you are working with my technology, but you are not working with my parents' technology. That's always a issue comes. So we have to, that's why we told that the digital fasting has to come in the family also. So that we have, so digital fasting has to come in the family. Sometimes may not be taking away technology, but I think they can make a conscious call that when they will be without technology and they can use that time for certain other activities.
Okay.
Sir, there was one parent and child, so they were fighting. So Rocco was very easily formed when I said to the child, the parent was complaining कि वो PUBG बहुत खेलता है और ऐसा करता है वैसा करता है. So I told the teenager कि तुम अपने parents को PUBG क्यों नहीं सिखाते हो. So that led to a good rapport formation, and after that we could go on quite well. So that is one experience I had to share. Sir, one question. There are a lot of praises coming for you for your
पर एक
presentation.
यहाँ पे क्वेश्चन ये भी आ जाता है कि now online games is also becoming a career because e-sport has also come into the domain. So it again require careful screening कि whether the child has any career in e-sports, because child say I am a player, I am as good as any sports player, so I don't have mental health issues. So it's required a lot of careful scrutiny on the part of clinician also. If you feel that child is doing very good in esports, then we have to educate parents also. In some of the cases, we have taken that call also.
Yeah, Dr. Charles
Sir,
Pinto has
sir,
that in
sir.
the chat. So there are
Alim,
so many
I'll just add one thing. Sir, if
Yeah.
suppose a parent brings a standard 6 studying child to you, telling that he's always on PUBG, and the child tells I have no mental health issues, I want to be a PUBG world champion, or I want to fix my career. So now, you know, what is the solution you will give? How will you assess that this guy might not be able to make a career in PUBG? What are the things you will tell? Because I have seen 2 or 3 cases where the child is absolute adamant on the fact that he or she wants to make a career in PUBG. PUBG is one of the most important thing that people talk about nowadays. So,
Because
how will you take a decision that?
Because early age, like especially when you're saying 6 year and all, we get children where they want to drop out from the school and want to have a career in gaming and all. Child has 10 years or 11 years. So parents have a concern whether it was my mistake to introduce the mobile phone to my child. That's why he built up this career option. But for us also, it becomes like a very, I think it's a clinician dilemma also, like whether we can say that child has any career at very young age, that in the e-sports or in the gaming. So what we generally works on, because if the child is quite motivated and cooperative for therapy, we brings a balance between gaming and other offline activities through the family interactions. Then in case if the child feel, that's I think best solution which we provide. And we also educate the child for building his lifestyle activities, maybe day-to-day activities, maybe school, maybe other thing. And then we phase out certain period of time when they can play games also, if that works. But in certain cases, as you are saying, this kind of client has come to us, but we have a very early dropout because child felt very much resistant to bring any change, and parents were able to bring them with force for 1 or 2 sessions, but thereafter they were not able to bring for any psychotherapy help. So I think thereafter, I think I also have very limited sessions intervention with this kind of client who have come at very early age, but they dropped out very soon from our treatment. So I would say at this moment, I may not know what will work for them, but that's always a challenge for me also, that what I would offer to this young child who is just 11 years or 10 years, who have just won 2,000 rupees sometime in the game, but he feels that I can win 2 lakhs also. I don't have any psychotherapy, I think, reflection for this kind of reasoning. So I think this is going to be my limitation at this moment, but definitely in future, I may be able to answer this question.
Manoj sir, there are too many compliments for you in the chat box. I am not able to take all the names because the list is very, very long. So
Yeah,
congrats
thank you.
for such a nice presentation.
Thank you.
Sir, just one or two questions. in this COVID lockdown, classes are going online. Does this add to the addiction problem, or is it not related, or what is your take?
I haven't got you. What you're saying, Ali?
In this COVID lockdown, most of the classes are online. So children are sitting in front of screen doing the classes. So does this add to this addiction issue, or it is not related? What is your take?
I think recently we did some survey among university students, and they also complains that ज़्यादातर जो use है, I think the increased use is because of online classes, because of online activities and all. I think very few people have said that, though they acknowledge that they are onto the other platform also, but they say majority of the increase is because of online classes and all. But none of them, I think very few are meeting the criteria for internet addiction also in this 600 population which we assess. So still, I think I need more qualitative experience in this regard to say whether which kind of children's or the users, because of online activities, have developed into addiction, and which remain resilient to develop addiction is require more qualitative approach. And maybe I think we are doing some work in this area, may answer this question in coming months.
One question to Dr. Sudhir sir. Sir, you spoke about naltrexone, it takes care of the hedonistic needs and all. Are there any studies, placebo-controlled studies, and about SSRIs, naltrexone, and all for internet addiction and all? If people wanted to, if you can elaborate a little on that, sir.
Now, honestly, there are not really very validated studies on the drug therapy. In fact, we do not have till date any protocols for comorbidities for internet addiction. Like we have comorbidities for singularly existing illnesses, protocols. Protocol for OCD, protocol for schizophrenia, but not if OCD is diagnosed with internet addiction, if depression is diagnosed with that. So I think for that, at least as of now, we have our own intuitive feeling and our experience. No good quality studies in this area.
Now you have mentioned naltrexone and anti-ADHD, and third one, which one?
SSRIs. SSRIs are perhaps used commonly the world over.
I think Vatve sir is there. Sir,
yes.
Would you like to comment? We cannot let you go.
Dr. Vatve sir. Sir, unmute yourself. Sir, unmute yourself, sir. Unmute, sir.
Dr. Amrit, can I share a suggestion? I mean,
Yeah, ma'am.
Sure, ma'am. Please, ma'am, go on.
All yours.
Yes, ma'am, please.
No, I just want to say that even I have used naltrexone in patients of internet addiction, 2-3, and for a long period of 5 years, and has given good results. Like they had left their job, IATs and they had not gone for the job for 6 months. But after they had comorbidity also, they improved and they went back.
Madam.
Thank you, ma'am.
What is the age group of the madam?
See, one was 26 and another was 32.
32. Both males of was there any females? Both were males. Both were males or females, madam?
Both males.
Thank you, madam. What way, sir? Your comments. Please unmute yourself, sir.
Murugesh sir, your comment.
Sir.
Yes, Dr.
Yes, enjoyed. Absolutely enjoyed. I sent a statement, a remark like that. Enjoy. Are you able to hear me?
Yes, sir.
Excellent presentation, and both chairperson have done a great job, and our friend, Sudhir Bhavi, as you said, is addicted to music. So this, again, you listen to IPS. And if you enjoyed, please continue this similar quality, great quality program. Before you close down, let me know the timing of the next program. And
8 o'clock, sir.
8 o'clock. 8 o'clock.
Next
it will never be changed.
Music is at 8 o'clock.
8 o'clock.
today we had to adjust.
Who is the speaker, sir?
To be 8 o'clock.
So next time I'll message you, sir.
Sir, it
So
was
can I take 2 minutes?
Yes, sure.
Can I take 2 minutes, sir? So I want to have a realistic view. As I see, technology and internet are going to take the upper hand, because not only the cyber marketing people, not only the teachers, not only education institutions, not only all other professionals, but also the people with the political good power, they are resorting to internet. When there is a election, internet is the main means of campaigning. So this is going to be there. In that background, we have to think where to draw the line. I shall only give 2 examples. One, if someone is, I have seen a boy of around 15 years who was a very good expert, upper rank expert in coding. So it was a game for his parents. They had complaints, but for him it was not this. Wherever he is, even if he's not a student, how to deal with him, where you draw the line appears flimsy in those conditions. And today we have discussed mostly on the adolescents, within bracket unmentioned adolescents about whom the parents are complaining. What about others? What about the millions of TikTok users and their clients? They don't come. And what about the other WhatsApp users who are not children, who are around 30, 40, and they spend more than normal, they have more than normal screen time? And do you have an approach to that? These are pragmatic questions for attention of both. And last, my request for Sudhir is there at the end. Let us listen to him. Okay.
Dr. Mir is waiting to give the thank you.
Tufan Pati sir. Okay.
हमने भूला.
Yes. Dr. Tufan Pati extracted a promise from me that I'll sing at the end of. We have crossed the time, so I won't take much time. I'll abbreviate my song. We had Friends Day just a few days back, and now I could see more than 200 friends here. So just 2 lines for the friends. एहसान मेरे दिल पे तुम्हारा है दोस्तों, एहसान पे तुम्हारा है दोस्तों, तुम्हारे प्यार का मारा ये दिल का मारा है दोस्तों. I think I'll end here. Maybe sometime later.
Sure.
So Dr. Mir sir is waiting to
Yes.
vote of thanks.
Yes, please vote of thanks.
Dr. Mir sir.
Good evening. Thank you. First of all, I thank to our esteemed speaker, Dr. Manoj Kumar Sharma. He's nicely elaborated the different type of addiction on screen. How we will get rid of that. And he also discussed about the different therapy and beautifully give the justice to our topic. Thank you, Dr. Sharma. Also, thanks to our expert, Dr. Sudhir Bhabe, Chairman IPS Subcommittee, Cyber Psychology Section, for his nice elaboration on the topic. And since 2018, he is consecutively 3 years is the chairman of this section. And he's nicely elaborated the different comorbidity in the treatment and the different app use and the parenting structure. Thanks to our chairperson, Dr. Shashi Rai and Dr. Mukesh Vaishnav for their active involvement and elaborate the topic nicely. Also, I thanks to Dr. Gautam Sir for his nice question to the audience and the chairperson. And thanks to our organizing committee, Dr. Tufan Pati, Dr. Amritpal Joshi, Dr. Alem Sadiq for their active participation and nicely organized the session. It is very useful, sir. At last, I also thank all the participants for their active participation and clarify their doubts. And also, I thanks to the IPS OSP, Odisha State Bank for supporting it. Thank you all for your nice consecutive more than 2 hours is active nice session. Thank you, Amrit. Thank you all.
Thank you, sir. Thank you, Mir sir.
Thank you.
Sir, before we end, Dr. Murugesh sir is waiting to sing. Murugesh sir. Murugesh sir. सर मुरुगेश सर एक गाना हो जाए आपसे खत्म कर देंगे फिर
क्या बात
मुरुगेश सर
अच्छा really great job done by Dr. Tufan Poti, Amrit, Alim, and
Murugesh
definitely what was sir, Murugesh sir, Sudhir Bhabe, and last but the best part is our speaker Dr. Manoj. Super presentation.
मुरुगेश सर एक गाना हो जाए फिर बंद कर देंगे हम लोग
क्या है मुझे गाना है क्या
आप गाना गाइए
रहे या ना रहे याद आएंगे ये पल ये है प्यार के जल डॉक्टर तूफान मेरे चल सोचे क्या छोटी सी है जिंदगी कल रहे या ना रहे याद आएंगे Thank you very much.
Superb.
Thank you Alim, thank you Amrit, and
thank you everybody.
Thank you Manoj Sharma for the excellent program. Keep it up. I
Thank
join
you.
every Thursday if you are keeping it.
Thank you Manoj sir.
Sure.
Thank you Sudhir
And
sir.
concluding song will be sung by everyday sir, Dr. Murugesh Vaishnav.
Thank you Murugesh sir.
Okay.
Thank you madam. Thank you Shashi madam.
You're
Thank you
welcome.
Tufan sir. Thank you Gautam da.
Good.
Thank you
Amrit,
Neeta.
Nice.
Thank you.
Dr. Tufan Poti, you have done really great. Bye bye.
Thank you sir. Thank you Manoj
Thanks
sir. We'll
everybody.
catch you
Thank
again.
you everybody.
Good night.
Good night.
शर्मिष्ठा मैडम एक तो गीत हो जाए
किसको
शर्मिष्ठा
हाय किया उधर
हाँ वो आगे चली जाती है वीडियो ऑन फिर बंद एक सेकेंड अर्चना बाय
Gautam, bye.
तेरा चेहरा देखने के लिए हम लोग करते हैं
everybody.
Bye to the organizers. A wonderful session.
थैंक यू मैडम थैंक यू सो मच
A novel ending with music. We should have it in all the sessions.
Yeah.
Okay. As long as
थैंक्स गिविंग के बाद एक सॉन्ग जरूर होना चाहिए
गुड नाइट ऑल थैंक यू
Okay, good night.
थैंक यू
Good
सो
night,
मच
sir. Good night.
आलिम का ये न्यू लुक है क्या
चाहिए सर
आलिम तुम्हारा क्या ये न्यू लुक है क्या
वो एक कोरियन सीरीज देखता है उसके बाद लुक्स ऐसा किया है वो सीरीज का डॉन है 12 बजे से 8 बजे तक
we expect
डॉक्टर गौतम ने अपना लुक चेंज कर दिया लगता है बहुत
दाढ़ी
दिनों
काट
के बाद।
नहीं मेरा लुक तो ऐसे ही है
दाढ़ी कट गया है।
पीछे बहुत दाढ़ी वाड़ी थी
वो भाभी से मार पड़ा
हाँ सही कह रहा है
ठीक है न्यू लुक है आलिम मार्केट तो
अलीम रबर बैंड खरीद रहा है
अमृत से पूरा खींच लेंगे वो
अमृत से तो भगवान खींच लिया अमृत से भगवान
ऐ, मारेंगे वो बात मत कर बाद में बात करेंगे दादा
गुड नाइट
सर
good night.
गुड नाइट सर
दादा गुड
Good
नाइट
night.
गुड नाइट everybody
Good night, sir. Good night.
अलीम भाग